How do ultrasound guided interventions get athletes back on track after injury? I'm Dr. Michael Lee, pain performance consultant here at Sheffield Sports Medicine. Thank you so much for joining me on a Thursday afternoon if you're checking in the UK, but some of you I know actually check in around the world, whether you're in America, in Asia, as well, to get more information to make sure that your health and your bodies are operating at their best. So you're probably actually thinking, we're come to August now. We're coming to the end of August. And if anything, this month has come so quickly. And we've been talking about how ultrasound can actually help, not only help other treatments, but also can give clarity as clinicians so that you know as a patient what's going on in your body. Because, you know, the great thing about ultrasound, as I see it, is, you know, when people talk to me about, hey, if I had a superpower, I'd like X-ray vision. Actually, I prefer to probably have ultrasound vision because you can see so much more in the soft tissue and also bone and ligaments and nerves and arteries and that. And I hope that this month has actually helped a lot of you really understand, you know, what has truly made it clearer in terms of how ultrasound can be used and how it can actually benefit you as a patient. And I know today we're talking about athletes, but I always say that an athlete's just a person. They're probably just a person that has a goal to achieve an incredible standard in a particular event. But it's the same with if you're just any other person, that you want to be the best version of yourself in life so that you can be happy. So this also is actually applicable for every one of you that want that success in your life as well. So let's talk about ultrasound-guided interventions, because let's do an overview of the interventions firstly, because ultrasound-guided, what it actually means is you use the ultrasound scanner to see what's underneath the skin, where it's the bone, the ligament, the muscle, the tendon, the nerves, the arteries, and then an intervention is applied to it to actually determine what sort of outcome we can. Because remember, the whole intervention, essentially, it's another word for a treatment. A treatment to then improve the current status of a damaged area to then hopefully make it even better. So the main interventions that are actually used with ultrasound are, firstly, it's injections. So there's quite a lot of different things that can be injected into the body. As a rule of thumb, this is just my own personal opinion, it's not right, and it's not wrong, it's that I believe that injecting things into the body should not be a long-term treatment for people with problems, because ultimately it's not really treating the root cause, it's just treating the symptoms. And that's why you need another injection, another one. It's not really finding out why this person needs so many injections, or why things are not working normally, and why they're always in pain in that area. So yes, we can inject lots of different things. So first one, most commonly, is anesthetic. So the good thing about ultrasound is when we actually have the probe and we've got the needle, we know exactly where the needle is, and what structure is. So it could be in like a joint space, it could be around a tendon, it could be, you call it a bursa, and we have clarity. So we know actually wherever it's been injected, that drug or that supplement is being put in the right place. So anesthetic is the most common one. So some people have it for dentistry, some people have it in joints, some people have it, you could even say, for surgery. So before surgery, they may have local anesthetic, right? People call it like a general anesthetic, where you could say shuts down the whole system. So that's one thing that can be injected. The second thing that can be injected is something called steroids. So a steroid, the whole purpose of a steroid is actually to control fluid, control inflammation. So if something is inflamed, it indicates that something's been irritated to produce that, we call it edema, or that swelling in that area. And yes, injecting steroid in the area will calm down that response of all this fluid that's been produced. However, it's still not finding out why is it producing so much fluid, why is it being irritated so much. But yeah, sometimes it's okay to calm things down, but the next step after that is, let's find out why it's happening so we can stop it from happening again in the future. So that's the second thing. The third thing that can be applied is, we call it ostenal injections. So if you are a person, or if you know someone that's really struggling with arthritic joints, so arthritis, or we call it osteoarthritis, another name is wear and tear. It's where the joints are really grinding together and they're wearing out. But I can tell you now, just from my research over the years of being a consultant, is that when someone has arthritis, it's not an age-related issue. Yes, people when they're older get more arthritis than they're younger. Yes, we get that. But the real reason why people get wear and tear, it's not because of age. Because just think about it. What can you do about your age? You can't really change your age, right? But what's really actually happening is because of overload. One area is being overloaded. Because if it was just age, the whole body, because the whole body's aging at the same rate, would have broken down at exactly the same time. But usually people complain of one area or two areas or three areas, but not the whole body, right? And we have to find out why is it one area? Why is that one area actually overloading? So when it is overloaded, we can actually put something called ostenil in the area, and it's a supplement. We call it supplementation. And essentially what it does is a catalyst to then help the joint produce more synovial fluid or more lubricant, so it actually rubs better. Or so it doesn't rub so much, rather, so it lubricates better. But again, it's not really finding out why it's overloading them. So yes, I say put ostenil in the area is going to help the joint move better. However, if we don't know why it's overloading, it might not even matter. So yes, again, ultrasound-guided injections can be helpful in terms of putting what we're meant to put in the area, then make it accurate. But ultimately, we still need to be thinking out, why is it actually happening? So those are the injectables. And now we actually talk about, I call it the non-injectables. And we see this all the time, particularly when I'm teaching around the world about different other treatments. And one of the treatments I'm going to talk about now is something called shockwave therapy. And it's when you have, it's essentially this machine that produces a lot of force, right? And it's actually, its whole purpose is actually to break things, to reset the healing process so that it can bring more blood to the area. It can actually bring, we call it bring on the acute phase, so it can start the healing process again. Because sometimes when certain areas of your body that gets damaged, it doesn't heal very well or it doesn't heal properly. And it's about resetting that healing process so that it has another opportunity to heal how it's supposed to heal. But the thing is that when we use ultrasound with shockwave, we actually ultrasound the area to then measure how bad this structure is. Because I know a lot of clinicians, when we're teaching about this, is that they just give shockwave without even scanning. And I say to them, look, why would you do that? Because you're shocking blindly. You don't even know if there's anything to shock. You're just applying a treatment which could actually cause more damage to the patient than good, right? So we need to make sure that you scan it, you measure. So it's usually, so shockwave generally is for tendons. So you shock it and you scan it, then you measure how thick it is. So if it's an Achilles, is it greater than 0.4 to 0.6, right? That's a normal range. So we want to see, is it thicker than that? If it is, at least you have a number. Apply the intervention of the shockwave in the specific area of where you've scanned, so you know exactly where it is. Shock it, shock it, shock it after 3 treatments, scan it again, and test. Has it got thinner? If it's got thinner, yes, you now have actually shocked the correct area, and now, yes, the patient has an opportunity to move forwards and now do the right rehabilitation, the right treatment to then make that Achilles strong again. But that's why we need to be clear. We need to see on ultrasound, is there anything to shock first? Because there's a lot of people that have Achilles problems, Achilles tendinopathies, or tennis elbow, or they have shoulder issues. It could be impingement or a rotator cuff problem. But they scan it and there's nothing wrong. There's nothing thick. There's no blood. There's no swelling. And then they go and shock it. I'm like, yeah, now you're going to create swelling. It actually makes their symptoms worse because it probably was never actually a structural problem in the first place. So this is why it's so important to really find out what's happening, why it's happening, just so that we can use the right tools to help the patient. So I hope that you finding this information helpful. If you have any questions, put it in the chat. Happy to help you, because if you're watching this, you're probably thinking, oh yeah, I know someone who's got bad knees or arthritic knees. I know someone who's got a really bad shoulder that might have had an injection or might need an injection. And yeah, we're here to help, because ultimately we as clinicians want to make sure we're clear in terms of what the right treatment is. Because the worst thing we can do is actually give the wrong treatment. And the wrong treatment that irritates someone, it makes their symptoms actually worse rather than better. So if you have questions, let me know. I'm happy to help you to give you any clarity, or you may be thinking about is this actually something that I need? Okay, actually, so I actually got a good question here. Thank you for giving me this question. How does ultrasound differ from CT scan? So CT scan is essentially, it's a selection of it's a specialist, you could say, maybe I'm not doing it any justice, it's a specialist x-ray machine. And a CT scan there's lots of these x-rays at different angles, and you can see different things. Generally, CT is mainly for bone, right? It can see soft tissue. I'm not saying it cannot, it can see soft tissue. However, the thing is that when people have a CT scan, and this is also the same thing with MRI scans, when a patient actually goes into getting the scan, they're in a position that probably isn't their painful position. They're laid down, right? But the thing is that with an ultrasound scanner, when we put it onto the area, we can actually move the joints, we can actually move the tendons, we can move the ligaments to actually see if things are impinging or actually compressing in those specific areas. And as soon as we know what's actually compressing, then it formulates better questions for us. Oh, now we know it's impingement. Why is it impinging? Now we need to do this to prevent that from happening. Yes, if I need to do an injection, let's calm it down, but we need to find out why this muscle or this nerve isn't working that's creating the impingement. So from my point of view, ultrasound is a dynamic scanner. You can put patients in whatever position you want, but essentially we put them in a position of where they get the pain, right? And then it gives us the clarity of, okay, this is what's happening. Now we know the result. But ultimately, it's about finding out, what's actually happening there, right? And it's about finding out what's happening there. So this is where I hope this is helpful for you. We have a connection issue here. Let me sorry about that, something happened with the internet connection. I hope you're back again in terms of finding out in terms of CT scanning and MRI. So I was back to saying that when it comes down to looking at when we're looking at positioning, if you're in a position of, say, CT scanner or an MRI, they're in a position of probably isn't the position that irritates them, and it just tells us the result. Okay, that's how bad it is. We don't know why. At least an ultrasound can tell us an idea of why it's actually happening. So I hope that's actually helpful for you. But if you want to have more information about that, let me know, because this is the reason why we always ultrasound structural issues that we think, and that gives us the clarity of, yes, how bad is it damaged, and the second thing is, why has it happened? The key thing is the why, though, because as soon as you have the why, then we know what to do to get rid of the problem. Because once we see how bad it can be or what could be creating it, now that's the beauty of I guess what we do here is that we treat the causes rather than the symptoms, and as soon as we treat the causes, we have the opportunity of stopping this problem from actually showing up in the future. So thank you so much for joining me today. If you've got any other questions, please do let me know. I'm more than happy to help. And although, yes, this does conclude the ultrasound series for August, next month we are looking at foods and how foods can also not only nourish you, but also destroy you. So if you're actually interested in finding out what these foods are that could potentially hurt you, but also could improve you, which are completely, I would say, it's not the opposite to general advice, but it has a different explanation to general advice. Because one of the things we always, when we speak to athletes about their diet, is if you want general results, get general advice. If you want specific results, get specific advice for yourselves, of course. So I just want to, again, thank you for being here, and I look forward to seeing you next Thursday for the next live, whether it's Facebook, YouTube, or even Twitter, or even Instagram. Thank you for checking in, and have a great rest of your week. Bye for now.